When I was a brand new ICU nurse, I remember coming home after shift so overwhelmed I could barely function. I was exhausted, anxious, and constantly second guessing myself. I knew I needed support, but trying to find a therapist who took my insurance felt impossible. Every option I found was either out of network or had a wait list months long. That's why I'm such a big fan of Rula, R-U-L-A. Rula is a healthcare company that makes it so much easier to find a therapist who takes your insurance, with sessions as low as $15. And instead of just matching you with whoever's available, Rula connects you with someone who fits your needs, goals, and preferences. Appointments are available as soon as tomorrow, and they'll walk with you every step of the way to make sure your care is actually helping. Thousands of people are already using Rula to get affordable, high-quality therapy that's actually covered by insurance. Visit rula.com/nursemo to get started. After you sign up, you'll be asked how you heard about them. Please support the show and let them know I sent you. That's rula.com/nursemo. You deserve mental health care that works with you, not against your budget. Well, hello there. I'm Nurse Mo, and this is Mo's Monday Minute, a shorty episode of the Straight A Nursing Podcast, where I share a quick tip that you can start using to improve your practice or habits right away. For more in-depth topics, then tune in with me on Thursdays. So today we are talking about, very quickly, the 6 Ps of tissue ischemia. And the 6 Ps are a set of clinical signs that indicate that the limb or tissue, whatever it might be, typically we're talking about a foot or a hand or an arm or a leg, has had a loss of blood flow. So these 6 Ps are pain, pallor, paresthesia, paralysis, pulselessness, and poikilothermia. So let's talk briefly about each one of these. So looking at pain, the pain with tissue ischemia, pretty darn severe. And the patient's generally having pain that is outside the level of pain that you would expect for whatever it is that they're going through. Let's say they had surgery to address a blood clot in one of the arteries that is feeding the lower extremity. And now their foot is having extreme pain. You wouldn't expect the foot to hurt, right? But if that blood flow to that foot has now been lost, that foot's going to hurt a lot. So pain that is often described as severe. Pallor is the next one, and that would be that the skin is pale or whitish in that affected area. And then paresthesia is numbness, tingling, or kind of like a burning sensation in that affected area. And then we have paralysis. This would be weakness of the affected area or inability to even move that limb. It's often when we're talking about limbs here, inability to move that limb at all. And then pulselessness. You go in, you're checking for that dorsalis pedis pulse, and you cannot find a pulse. So pulselessness in that affected area. And then poikilothermia, which is a really fun word that basically states that the limb is not able to maintain body temperature. So it's going to be cool. It's going to be markedly cooler than the other side. Like, let's say the right foot is affected, markedly cooler than the left foot. So we're looking at the 6 Ps of ischemia. Most of the time in our patients who've had some kind of vascular surgery, maybe they have had peripheral arterial disease, maybe they even have potentially compartment syndrome. So you would again be looking for the 6 Ps of ischemia, and they are pain, pallor, paresthesia, paralysis, pulselessness, and poikilothermia. And anytime you're noticing these signs, and I'm not saying you would have to have all 6 before you called the MD, but you're definitely letting somebody know when you're starting to see these 6 Ps of ischemia. So I hope this shorty episode helped you, and I will see you again soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Getting your prescriptions shouldn't take up your time. At TeleRx, we've streamlined the process to make it easy and stress-free. Visit telerx.com, where you can select from over 250 medications and place your order. A licensed provider will review your request, and if it's approved, we'll deliver your medication directly to your door, sometimes as early as the next day. No lines, no stress, just fast, reliable care. Try TeleRx today at telerx.com. That's TELYRX.com. TeleRx, prescription care made easy.